Hi, welcome everyone. Good afternoon. Thank you so much for joining our info session today on Health Data Analytics, our program. Today is an info session to tell you a little bit more about our program, which was co-developed by the UBC Department of Medicine and the UBC Data Science Institute. My name is Steph Chia. I am the research manager at the Department of Medicine. And my team, myself and Barlene Kaur, who's also joining today, our research coordinator, we help support this course delivery and along with the UBC Extended Learning team. So for today, we have the next hour, which will give us plenty of time to talk about the program. We'll tell you a little about why we created the program. You can meet some of our lead instructors and what you would expect to learn in this program. And we've left a lot of time towards the end to answer any questions you might have, specific questions about the program. So please do feel free to ask those questions. We are recording this session and we'll be posting it on our website in case you need future reference. Before we begin, I'd like to acknowledge that the Health Data Analytics Micro-certificate was conceptualized and developed at the UBC Vancouver, BC campus on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. I also want to acknowledge that you may be joining from various locations and territories, and I'd also like to acknowledge the original traditional caretakers of those lands. This is our agenda for today's session. We'll start with some brief introductions, and we'll go over why we developed this program and curriculum for each of the courses within the program, the goals and benefits and potential career applications of the micro-certificate. We have also invited a former student who completed the micro-certificate to share about their experience. And then we'll have our Q&A session where we'll have plenty of time for those questions. We'll be asking you to share your questions in the chat box, and we will answer them during our Q&A period. So before we jump into the program information, we kind of wanted to get to know who has signed up for our info session today and who is attending. So we're going to launch a poll with just a few questions to learn more about who you are and what you're trying to gain from this session. We'll give you a few moments to answer the 5 questions. What's your current, we want to know what your current profession is, which courses are you interested in taking, how did you hear about our info session, and then what are you hoping to gain from this program? So please, hopefully a little box popped up so you can just quickly answer those questions. I'm not sure if we got any responses for the poll. Were we able to get responses for some, Marlene?
Yeah, only a few people answered, but I've relaunched the poll.
Oh yeah, there we go. And then maybe after like 1 more minute, we can just quickly share the results so our instructors can see who we have today. Okay. Maybe 10 more seconds.
Yeah.
Okay, so it looks like we have a good diverse attendees today, ranging from the physicians, clinical staff, health admin, a lot of researchers or researcher staff, and then some others. And pretty even split on who they want to take all 3 courses of the program, which is great. Yeah, and then hoping to gain from this program practical skills, 90%, and then some career advancement opportunities. And most are somewhat familiar with health data analytics. Great. Okay, so that's great. Thank you for joining the session and answering those polls. So just before we dive into the program details, I wanted to let you know that this program was developed by our leads, Dr. Anita Palapu and Dr. Raymond Ng. Dr. Anita Palapu is a professor, the Eric W. Hammer Chair, and the head of the Department of Medicine at the University of British Columbia and Providence Healthcare. She is also the co-lead of the Data Science and Health Research Excellence Cluster. Unfortunately, Anita was not able to, she had a meeting conflict and was unable to join our info session today. But we do have Raymond Ng here. He is a professor of computer science at the University of British Columbia and the director of the Data Science Institute. He's also the holder of the Canada Research Chair on Data Science and Analytics. We also have a couple of our course instructors joining, Dr. Mint T and Dr. Leon Rocco, who I will introduce a little bit later. So for now, to talk about the program overview and curriculum and the development of this program, I'm passing it off to Raymond.
So thanks, Steph. Good afternoon, everyone. Thanks for taking time to join this session. I know it's sunny out there, so I want to make sure that you're not wasting your time with us. So I want to give you a quick program overview of the micro-certificate program, and then in terms of individual courses, we will also talk about that later. So the design of our program is intended to be 100% online and it's part-time. We are very interested in developing this kind of curriculum to upskill healthcare professionals, broadly defined as we have seen in the survey. And so the idea is that while you are doing, your jobs, your daily jobs, we want to be able to give you some content. Roughly, we are thinking about 5 to 6 hours per week, including the lectures, the assignments, and the discussion boards. And that would typically take about, I would say, 6 weeks for each course, and so that you could get the lectures asynchronously at your own leisure. And so we have all the video clips. Having said that, though, we also understand the value of having some synchronous discussion sessions where we will have our teaching staff and our teaching assistants that would have office hours and will have live discussion with you, and so you could join and then we could discuss. And from what I have heard, some of those discussions were actually extremely interesting. So as I mentioned, this program consists of 3 courses, and so roughly 90 hours. First one, Introduction to the Big Data Era and Opportunities for Better Healthcare. So it's almost like an overview, and it's very focused on BC. And then the second course is on health data and data visualization, which is, of course, I think many of you will encounter that in your work. And then the final course is the most, I would say, the more analytics part of it, and certainly a little bit more technical, where we will be talking about data analysis and a little bit about machine learning. And so the 3 courses you could take in any combination, and you don't need to take all 3 of them, and it's $950 per course. And we intend to, for this year of 2025, we intend to have 3 cycles. And in fact, the next one, course 1, is going to start next week. So let me explain a little bit why we developed this program. As I mentioned, it's very important for us that healthcare professionals, I think if they are not already seeing that in their work, seeing data science tools and AI tools, and so we want to make sure that we allow people to upskill so that they could work more effectively And so that is so that's really the one of the key objective. Now, the reason why in your work, I'm sure now you are seeing more and more of these tools is because there's a growing diversity of health data, growing amounts of health data, and at the same time, we know that the computational capabilities are also improving. What we could do now with our laptop, or even with our phone, is tremendously, better than, let's say, the same device, let's say our phone, 5 years ago. So with increased computational power, we really want to be able to capitalize on the data so that we could learn from the data and be able to extract from the data so that we could bring benefit to what we do in healthcare. And then the last point I would make is that we, through this program, and this is actually one of the reasons why we want the synchronous, session, we want to build a community of practice in terms of people using health data science tools as part of their work. So we are very fortunate that we got a lot of support from the entire ecosystem in healthcare in BC. And when we asked around and to ask for speakers for our course, particularly the first course, we have a wide variety of lecturers who give invited lectures to talk about from their perspective, and again, very diverse, perspective from, Ministry of Health, PHSA, to, health authorities like Fraser Health, Vancouver Coastal, Providence, and then to, BC Cancer Arthritis Research, substance use, etc. So I think you will hear from those invited lectures very interesting perspectives from different angles within the healthcare system of BC. Now, I want to just finish off this discussion about the program overview by talking about who we have designed this program for and how, at a high level, we expect a learner to be able to, benefit from. So this is intended to be, very broad, and is intended to be for healthcare professionals who are working. And it's great to know from the survey that there are physicians, there are clinical staff, there's research staff, there's researchers and administrator. And that's exactly the types of groups of people that we would like to them to be able to benefit from this content. We want to provide a little bit of practical knowledge and skills, and that is why we have assignments and tutorials, and I would say that they are very they're relatively lightweight, but it gives you some hands-on practice about some of the concepts that we introduce, and then maybe do a little bit of analysis. I think that is more for course 3. I talk about the upskilling aspect, so this is not necessarily saying that after you take this course you will become a health data scientist. It is not for that yet, but we want you to be able to understand what health data science is, so that maybe at a different, now that you have a better understanding, maybe then you say, oh, maybe I should now go to UBC and take a professional master's degree, like a master's of data science. So this is about giving you the knowledge, giving you the upskilling opportunity, and so that you have a better understanding of whether you want to do a career transition or not at a later point. And as I mentioned, it's about literacy, allows you to understand the fundamentals and then apply that or think about how to apply that in your day-to-day work. And the goal and the hope is that you're enabling you to work more effectively, data scientists, analytics professionals, and in fact, increasingly so, you might be operating some of those tools that are considered data science tools, AI tools. And so that when you operate them, you become a lot more confident and you become a lot more competent. And then, there's obviously the community component, to it. So we want to grow this health data science ecosystem within BC. This program is obviously not the only thing, but I think we are hoping that in this program, we actually play our role to be able to grow this community of practice. The last slide I would talk about is what this is not, and I already mentioned that this is not an advanced data analytics training program. And so what you're going to learn in this program are mainly literacy, but it's not really preparing you immediately so that you could do a career change and become a health data scientist. Maybe I could just say one more. This is the Micro-certificate program. We are developing, the same team, the Data Science Institute and the Department of Medicine are designing a second micro-credential program, which is slightly going deeper into natural language processing as it applies to healthcare. I think if you're really thinking about a future career change into health data science and become a health data scientist, I think if you take the first program and then the second program, then you might be kind of more than halfway there. Now, you might be asking, this is about the first program. We're obviously not talking about the second program, but in fact, the second program is not even launched yet. So the second program will be launched in 2026. So we are talking about 1 year down the line. So with that, I'm going to pass this back to staff, and I think we're going to talk a little bit more on individual courses.
That's right. Yeah. So now we're going to discuss the curriculum of all 3 courses. We have course 1, the Introduction to the Big Data Era and Opportunities for Better Patient Care. And I'm going to, in 1 second, invite Dr. Mint T, who is an assistant professor in the Division of Social Medicine and also a research scientist and health admin data lead for the BC Center of Substance Use, to talk a little bit about the curriculum. But before that, I just wanted to let you know she is an epidemiologist by training. She leads a project of a province-wide population level linked administrative cohort that aims to evaluate naturally occurring policies and interventions to optimize health systems for people living with substance use disorders. So she has a lot of experience and currently works in this field, and she is one of the lead instructors for course 1. So Mint, you can go ahead and talk about course 1.
Thanks, Steph. Just generally in the 1 slide I have, the first course really provides an environmental scan of the current landscape of health data specific to BC, and it includes a lot, but not all of the available data sets and ones that are most commonly used in the health field, as well as platforms and the application of data analytics in healthcare delivery. The course uses very specific and practical examples such as the use of AI and computer vision for echocardiography, natural language processing for mHealth, and ambulance deployment in healthcare operations. So, for those who are interested in kind of the more clinical aspects, or whether it's operational aspects, or those who are in the research field, there's kind of bits and pieces there for everybody in terms of their interests. So the overarching goal is really to help people understand how to identify the right data sets and analysis techniques for impactful health data applications. I'll pass it back to Steph.
Thank you, Mint. Sorry, I moved ahead to this next slide. So curriculum highlights for course 2 and 3. I'll now have Dr. Leon Ruocco, who is a data scientist at UBC's Data Science Institute, speak about that. He holds a PhD in physics from UBC and works on artificial intelligence and machine learning solutions to problems in healthcare. So also our instructors all have expertise in the fields of what the course covers. He's one of the instructors for course 2 and course 3, so health data and visualization, and then health data analysis and machine learning. And Leon, can you please provide an overview of the 2 courses?
Sure. Hi, everyone. Thanks, Steph, for the introduction. So yeah, I'll give a brief high-level overview of some of the course content for courses 2 and 3 in this program. So in these courses, we'll be going into more detail when it comes to data analysis and machine learning as it pertains to concepts in healthcare. So in course 2, as you can see, titled Health Data and Visualization, we'll be discussing how data is processed, cleaned, and ultimately stored. And this is, of course, a very important concept now in the modern era of big data. So we'll also be spending a significant amount of time discussing how data can be explored, especially from a visual perspective. So, how to present data graphically in an informative and meaningful way. And this will dovetail nicely into data communication skills, where we'll discuss principles of study design, how data should be collected in a meaningful way, such that we mitigate things like bias and confounding. And finally, we'll touch upon important ethical considerations regarding collecting and storing and presenting data. In course 3, titled Health Data Analysis and Machine Learning, we'll dive into some of the core themes within this vast field of machine learning. And in fact, we'll be touching on some aspects of artificial intelligence and deep learning. And so this course is purposefully designed to circumvent the need for any computer programming skills. However, machine learning, like many things, is best learned by doing in a practical sense, which is why much of the course content is presented using this primarily learning software program known as Weka. Nevertheless, the theory presented in the course will all be very standard stuff that you'll find in any machine learning textbook, just without the coding prerequisite that often accompanies a course like this. So the real benefit here is that you'll have the opportunity to learn these machine learning concepts by applying the algorithms, to realistic data sets, again, contextualized within healthcare, but just without the need for hard coding. So instead using this user interface Weka instead. So, more specifically in this course, we'll be going over supervised and unsupervised machine learning. We'll also touch upon some pillars of artificial intelligence, such as natural language processing and image processing. But again, both by taking a hands-on approach and working on some projects that relate to these ideas. So yeah, thanks. Hopefully that's an informative overview of those 2 courses.
Yes, thanks, Leon. Okay, so now we have invited a former student, Kenny Hammond, who has completed all 3 courses and received his micro-certificate. So congrats, Kenny. Kenny is the manager for research data services at Digital Solutions in the UBC Faculty of Medicine. He holds an MPH and has been working with medical education and research since 2009, and he strives to engage with clients to find technological solutions to support their needs, whether for research or medical education. So this course, I think he found this program very relevant to his current work. So I'm going to stop sharing so we can just have Kenny on the screen, and I'll just ask him a few questions about his experience. Okay, so Kenny, you took this course last year. I mean, we only ran the program last year, so you've just recently completed the course. I was wondering if you could kind of share with everyone why you decided to take the micro-certificate and complete all 3 courses. Oh, you're on mute.
Double muted myself. I apologize. Thank you so much, Seth, for inviting me to speak, and for everyone watching. I'd like to start by saying this course was a really great experience for me. So I think the why did I decide to take the micro certificate? There's kind of 3 things that came to mind immediately. When I started in my role, I worked quite a lot with researchers, all different types of researchers wanting to do work across the healthcare field. And I would go into meetings and sometimes not have what I would call the language to be at their level. And I didn't really know enough about what data science was or how to put it in context or what different sources were. And I thought this course would help me get that language. So when they're talking to me, I wouldn't be frantically Googling something. And actually, it absolutely achieved that. I use information I learned in this course every day in my job. It's actually been one of the best things I've done to upskill myself. That's the other second reason is upskilling is important in keeping myself familiar with what's out there, what's happening. Doesn't only help me, it helps my team, it helps the researchers I work with, it helps the entire faculty. So I thought that was important. And finally, I don't come from BC. I was born out east. So understanding the different data sources that was out there, like who's who in the zoo, what's going on, was really helpful. Again, I've actually pointed researchers to different data sources and been like, hey, have you thought about this? Have you ever considered this? There was one presentation that was talking about machine learning, large language models, and I've actually connected a researcher to people who gave that presentation. So you can actually really make some interesting kind of connections, perhaps, and learning what's out there. And I think that really helps.
That's great. Thanks so much for sharing your positive experience with the program. And sounds like you kind of you've definitely joined the network of the health data science network with the community. So maybe you can share a little bit about an specific part of the program that you found quite enjoyable or what really stuck out to you.
Absolutely. So the presentations themselves, the lectures, they were great. They were quite diverse. You get quite a variety of speakers, both people who are practically working, academics, everything in between. So I love that. There's 2 that like really resonated with me. There was one presentation from BC Cancer that I was just floored by. I honestly think about it every day. And there was another presentation from a gentleman who was talking about ambulance resourcing. And it was just so practical and tangible and like impactful that I found that was quite enjoyable. The discussions with the other students were incredibly engaging and rich. You get quite a diverse cohort. So it's not just going to be like myself. I actually come from an IT background, but you get people who are physicians, people who are researchers, and everyone brings their own perspective, sometimes completely fearlessly, where they'll share stuff. And I was like, oh, wow, that's really interesting. So I found that super engaging. And the using Weka on the last part, the hands-on piece, was really nice to kind of consolidate my knowledge and actually kind of give me some hands-on stuff. My colleague also did the course, and I know her big takeaway was how much fun she had using the software. So I think
That's
those are
great.
kind of the three things I enjoyed the most.
Amazing. Yeah, it's nice to hear it's actually some like fun to take this course
Oh, yeah.
and not a chore. Was there anything in the program, any of the courses that maybe surprised you that you weren't expecting or was a bit different than what you thought it would be?
I think the last course, I definitely spent a bit more time doing the hands-on work, both because I enjoyed it, but also because I felt I wanted to dive in and make sure I learned the concepts and kind of made them kind of, I guess, concrete in my head. Just from someone who works at UBC and has done a lot of these types of extended learning courses, this was the thing that surprised me is how well designed this was and how well laid out it was and how engaging it was. This was actually a different experience than I had in other courses, and I would say it was a step above other things I've done at UBC.
Oh,
So I was very
okay.
impressed by that.
Great. I mean, I have not heard Kenny's answers before today's info
No.
session, so I'm pleasantly surprised. And we did not pay Kenny to say these things.
No.
Thanks for your honest feedback. So last question for you is, do you have any advice for the learners who are on, or potential learners who are on the call today, about what they could do to take this, if they should take this course, and how they could get the best experience out of the program?
Yeah, three things also came to mind. First of all, I would challenge everyone to think about problems you face every day at in your work and how data could be used to help solve those problems. You can be creative, you can have fun with it, but I think that's a really good way to start. If you even start thinking about that now, that will set you up for success. I would encourage people to block off time to actually watch the lectures. I watched many of them in the evenings, as I had a 4-year-old running around. That maybe isn't ideal, but I did go back and revisit them many times. I really strongly recommend people review the information from other learners in the program and like the discussions. I think both Anastasia and I, who took the micro-certificate, really found learning from others. Again, it helped consolidate the information, but it also really showed me what everyone else is doing. I thought that was really interesting. I've actually had people from the cohort reach out to me since and like introduce themselves and say, hey, I didn't know you did this with this software. There's an opportunity to maybe work together. So I really like that. The final thing, don't be scared of the technical piece. I think a lot of times people get focused on, all the new stuff with AI, machine learning. This course is not scary, and the way the information is presented is actually presented in a really consumable way. So if sometimes people get cold feet when they see technical stuff at the end, it's very, I don't want to say easy, because easy is objective to someone's own experience, but it's very doable, and it's fair, and it's something that may be challenging for some, but everyone can definitely get through the technical piece. It's not going to break you. Yeah.
Great. Thanks so
So
much,
Steph,
Kenny.
could I just add
Sure.
add a comment? When we were 2 years ago, we were thinking about the title for this program. One of the option was exactly trying to call it demystifying AI or data science. And so it is exactly your point, Kenny.
Thank you.
Mhm. Thank you so much, Kenny. I really appreciate you taking the time to join our session today and share your experiences. I think it was super helpful for everyone to hear what it was like to take the courses, and from your background, and how you're using it, what you've learned every day. So thanks so much.
Cheers.
Great. Okay, so we have finished the presentation portion of our info session today, and we're moving on to our question and answer period. So yeah, we have Dr. Raymond Ng, Dr. Minty, and Dr. Leon Ruoko here to answer any specific questions you can have, either for the program in general, the 3 courses, logistics about even registering for the course, the content, specific content for any of the courses. Please share your questions in the chat, and we can answer them for everybody to hear. And while we're waiting for the questions to come in, if anyone wanted to share anything that might have been missed, please go ahead.
So maybe, oh, okay.
Oh, we have a hand raised. Okay. So does Othmo are they able to unmute to ask the question? Maybe Othman, you can ask your question if you're able to unmute. Or if not, we'll have to put it in the chat.
Hello. Hey, sorry, I wasn't able to unmute initially, but now I can. Thank you all for this introduction. And I'm sorry, this might be a selfish question in the sense that it's kind of personal to my situation, but I'm interested. I'm actually a fellow working in UBC, an infectious disease department. I'm interested in AI. However, AI now, as you all know, is becoming a buzzword. Everyone is throwing AI around. I'm interested in what Kenny said specifically, that this course helps in like into linking the kind of common language, common grounds between people who have no experience in this, with no data science experience, with data scientists. So I'm anticipating that I would work with data scientists in the future, especially that with my personal interest in this. So I was just thinking if this course has any prerequisites, like programming prerequisites or any sort of knowledge, baseline knowledge of data science before, or is it for anyone from all backgrounds? That's the first question. And then the second question, being in a full-time kind of job, I know in the introduction you said there is it's 100% online and there everything will be recorded. So is it feasible or reasonable to say that I can join in with my own pace, own time, and kind of just fill in the assignments later, or is it something that we need to set up specific times for meetings that I have to be there for it? Sorry if this is too long.
No, thank you for your questions. I think that's relevant to everybody probably who's listening. First question about the prerequisites. There aren't any prerequisites, but the third course, which is the most analytical, even there's no prerequisites, but it is the most technical one. I don't know if Leon, you want to share about anything related to that. Like everybody should be able to use the WECA tool, and there's guidance on how to do those things. And there's questions. If there are questions, we have the office hours to address them.
Yeah, I can elaborate on that. So in my opinion, the only technical prerequisites would be very basic stuff regarding just the operational use of a computer, essentially. The course was very carefully designed to avoid any need for computer programming, explicit computer programming skills. And so all of the content will be essentially presented, and then the assignments will mostly use this software known as WECA, which is just a user interface that will be very intuitive to use, much like many other programs that are used on a day-to-day basis on your computer. So I would say it's very accessible to the general population.
And I believe the second question was how, kind of logistically, how can a working professional take these courses? The courses are all 100% online, and there is some flexibility on when you would watch the lecture videos, which are all pre-recorded. So you can break it up into chunks, like a little bit every day, or if you have a one day to dedicate to that, you can choose to do that. There are some weekly requirements though, like there will be assignments. Some of the courses will have a weekly assignment, which with a due date, although the due dates are all at the very end of the course. So you can choose to submit them like as you're going through each module, which is one module a week, or you can choose to submit them towards the end. But I think as a student, you would get more out of it by submitting them more during the course to get feedback and just kind of learn it, instead of leaving it all towards the end where it might you might struggle in some cases and have no chance to ask questions. So that would be, I mean, it was designed for working professionals. The idea is that it shouldn't take more than this 5 or 6 hours a week to do go through the materials and the assignments.
Maybe I'll just add for course 1 that the assignments there's 4 assignments, and then there's a final capstone, and they are due at the end of the week. But you can choose to submit them at any time during that period. And then I'll also just mention that the once a week Zoom session, the synchronous part of it, is optional and will be recorded. So for those who aren't able to join for course 1, it's Mondays at 6 p.m. That's totally fine. You can kind of watch them after the fact.
So Steph, if I would just add a comment to the question about prerequisite, I think one of the very common question on prerequisite is about math background and or programming background. And so on those two specific examples, there isn't any, that we don't require any math skills, we don't require any programming skills.
Okay, I see some questions in the chat now, which we can go through. There's a question about, can the second course be taken without the first, or do they build on each other? Do you know what, let's answer that one first. And no, the answer is no, they don't need to go in order 1, 2, and 3. But I believe when it was designed, it would be nice if you could do 1, 2, and 3 in the mind, like transitioning from those courses is a nice flow, but they are standalone courses that can be taken in whichever order. Anything else to add about that, Raymond? Or?
Yeah, I think one of the questions on the chat was that someone was saying that, oh, I already know about data analytics, and is it a good program for me if I try to learn about health data in BC? So using that as an example, maybe the good thing is to start with course 1 and then maybe course 2, and maybe not thinking about taking course 3 if you think you already know enough about the basics of machine learning. But then I think we also have students or learners who actually started off just taking course 3, and then they actually like it, that they in fact go backwards. That is fine with us too. And so, I mean, it's really, do it at your own pace and do it at your own pathway, kind of, designed for the entire program.
So the second question was, do you know what time and day the courses will happen? So as Raymond had previously, you had covered that the courses are asynchronous, so they do have a start date and end date. They run for the 5 weeks. So the first course 1, the next offering is starting next Tuesday, January 14th. And then it'll last for the 5 weeks, and then course 2 will start like a week after that. We are running the courses 3 times in 2025. So all 3 courses will be run 3 times, and it'll go from like January till December. So there's a lot of opportunities. If you can't make one of the offerings that are happening, you can sign up for the next one coming up in the summer term, or then the fall term will be the last one. Okay, so there was a question about whether it's possible to share an example of an assignment from each course. Like maybe just talking about what an example of what would be asked for in the assignment. So Mint, if you could do course 1, and then Leon could share from course 2 and 3.
Sure. So maybe I'll give the capstone project as an example, because it's the end of course assignment, if you will. There's no final exam or anything like that. I think that was another question in the chat. But the capstone project is really trying to take all that folks have learned throughout the first 4 weeks and try to come up with a question, whether or not it be a clinical or operational or research challenge that you're facing in your everyday work life, and figuring out how to take that challenge and work through how we can use data analytics, the data that we have available in BC, to try to answer and solve the challenge that you're currently facing. And it's I think it's a 2,000 word project, so it's not too hefty, and it's broken down into the 4-week sections based on common themes around that section. You're not expected to actually go in and look at the data and explore and give back results or things like that. It's really just the front end to try to conceptualize, your challenge and how to go about addressing that.
Yeah, I can give examples from courses 2 and 3 also. So course 2 is quite a varied course. And so maybe I'll also just give the example of the final assignment. So bearing in mind that course 2 concerns things like data communication, data visualization, and statistical analysis and concepts like that. The final assignment is ties all of these concepts together quite nicely in the sense that you actually are presented with a research report. I think in this particular case, it was a fictional research report, but actually some other previous assignments in the course, I think, also studied genuine peer-reviewed papers. Nevertheless, the assignment is to perform a critical analysis of this research report, and so you'll analyze methodological errors, if there are any, analytical errors, and possible evidence of bias and other ethical considerations that you might identify. And then course 3 being the machine learning focus course. The assignments by and large often take a similar format. Like we've mentioned, using this Weka software program, and what you'll usually be asked to do is you'll be presented with a healthcare related data set, that will be given to you. And then you'll basically be asked to analyze it using some machine learning method that you're ideally learning this in that course and that assignment. And so the machine learning method will be implemented using this Weka program, and you'll be analyzing the data set and then hopefully learning the concepts and theory along the way.
Great. Thank you. And if you have more specific questions, we can drop an email at the end of the info session if you have if your question wasn't really answered to your to full. So one other question from somebody was, they want to try to figure out if this course, the program is for them, and perhaps if you can kind of mention, is there anyone who would not be appropriate to take this program or who's not a good fit for these courses? Raymond, do you have any comments on that?
Well, I think as I mentioned, I think we designed this program to be for different across the board, healthcare professionals, and so it's by design, not expecting any background. So if anything, I would say that if you already know the material or some basic material in machine learning, in AI, in data science, and then you have already been working in the health sector, maybe you'll find the material, too simple for you. But I would even for people who are already, let's say, working in the healthcare sector doing data analytics, I think, depending on how much you have used, for example, data visualization, maybe the course 2 is interesting to you, depending on how much you know about all the interesting data sources within BC, maybe course 1 is interesting, to you. So I really think that if you're too advanced, maybe this course is not suitable for you. But other than that, I think the program is designed to be, very broad.
Okay, I have a specific question on some curriculum content. Do you cover principles of data extraction from patient records?
So we talk a little bit about that in the NLP in course 3. And when I say a little bit, I don't remember but let's say that it will be roughly an hour, just full of examples, but not necessarily the nitty-gritty of how to do it. So it's more about application. So similarly, I think there's the question about image analysis, and I think the level that will be touched on it will also be kind of at that level. Maybe Leon could confirm, but again, we are not talking about the nitty-gritty of doing image segmentation, for example, except to say that what does segmentation means, how do we apply to radiology, and concepts like that.
Yeah, I can quickly elaborate. So In both of those cases, there's a lecture and an assignment assigned to each of those. So there's an assignment for natural language processing applications, and then there's also an assignment for image analysis as well. And it's as you said, Raymond, you know, in the case of image analysis, we're not necessarily going into the full gamut of image analysis, of course, in the context of machine learning, but we'll be focusing in on one or two key concepts. So, for example, in that case, it will be within the context of what is known as feature engineering. And so, you know, we'll be discussing some of the methods there, and you'll be applying them in your assignment. But you know, with respect to the healthcare data extraction question, just in case the question was related to was more related to whether or not you learn about data extraction within the context of creating structured tabular data. You know, to my knowledge, it's not. We're not going to cover that in the course.
Okay. All right, some other questions here, which Varlene has answered some related to office hours, which there are for all three courses, there are live office hours and they're optional, but encourage for students to participate and ask questions and interact with the other learners in the cohort with them. I believe there's a question about assessments. So whether there's like a final exam that they need to study for each course. There is no final exam, but for two of them, there's a final assignment, like you're mentioning the capstone project for course one is percentage wise is a big chunk of the mark. And then course two, I believe, also has a large final assignment. And then course three, it seems like there's just assignments throughout, no one final big one. But your grades will be determined through their self-check quizzes, like multiple choice quizzes at the end of a module, participation and discussion, and then your assignments, which makes up, I think, the big chunk of the grade. And just to, I'm not sure if we shared it, but this is a pass-fail course, and you need 70% to pass in order, if you're going to go for the certificate, you'll need to pass all three courses. Okay, so I see a few more questions. Let's see. This question is about, do the assignments allow for pursuit of one specific research interest? Is it geared more towards someone with a medical background? So this person has a background in MHSU rather than medical. Is that question clear?
I'm assuming MHSU is mental health and substance use. And if so, my answer would be, at least I can speak to course one, and I'm sure it's for the whole micro-credential, is that I think it's, like Kenny mentioned, more valuable if you are bringing in your own you know, research, whether it is research or clinical interests into the course as more of like an experiential learning. And you'll definitely get a lot more out of the course, I believe. So yeah, and I think, as was mentioned earlier, there's a lot of the speakers don't have medical backgrounds. You know, they come from all walks of life, and so I think you'll get pieces from, you know, kind of people with different disciplines. So, for example, like I do work in mental health and substance use, and I don't have a medical background. You know, I think there's a whole variety of folks that come through that I think could benefit from the course.
Yes. Okay. I see we have about 5 minutes left of our time. I'm probably going to try to narrow down to 2 or 3 questions if we can answer them. And then if there are additional questions, we can we'll share the contact information in email, and also this recording will be provided to everybody after the session. So this question is about career opportunities after completing the course. So Raymond, it was for you. Can you emphasize any potential career opportunities after completing the course, particularly from the recent immigrant's point of view?
Well, I think I think I talk about how this one program is really mainly designed for upskilling, and I think Kenny talk about that as well. So I'm not sure whether it just on its own, this program is going to allow you to change jobs. That okay, I'm going to change my career now. From now on, I'll be a health data scientist. So I think is not intended for that. As I mentioned, by the time that you have this first program and then the second program that we are developing, then maybe you are more than halfway there for that career change. However, I actually want to make a comment that when people talk about upskilling, I think in the context of data science and AI, now I'm just going to go very, very broad stroke. Is really, as you know, people talk about how AI could actually take away jobs. And at that very broad level, I think what we are trying to do in designing the micro-credential program is to make sure that, for our workforce in the healthcare sector, we want people to stay with the job, take advantage of the experience, and all we need to do is to give them a suitable dosage of data science concepts, skills, and so on. And so we often joke about the fact that in the healthcare setting is not so much if AI is going to take away jobs. It's actually people who know AI is going to replace those people who don't know AI eventually. so in a way, this is really the from my perspective, is really how we approach designing all this micro-credential program in this data science AI space, is to make sure that people keep on growing in whatever capacity, whatever career stage. We want to give them the state of the art so that they are going to stay in the jobs or maybe progress along their career ladder. But now with the new literacy and new competence in terms of data science and AI.
Great. Okay, I think maybe one last quick question, very specific about how are we cleaning and analyzing data in the second course? Are we using Python? Leon, do you want to answer?
So in the second course, again, much like the third, there will be no need for any Python skills. In terms of the course material being related to data processing and cleaning, there's not any like hands-on element to that necessarily. It's more presented in a conceptual way. And it's primarily presented, that course material, within the context of data warehousing. So basically how data is stored and processed for the purposes of downstream analysis tasks. And so you'll learn about we'll touch upon and discuss concepts like database querying, how to compile and aggregate data in ways that are useful for downstream tasks. So again, no need for any hard coding skills or anything like that.
Great. Thank you so much. So actually, we're about the end of time for our info session. I really appreciate all the attendees who spent the last hour with us. Thank you so much for joining, and we hope you will participate and register for any of the courses in this program. Varlene has shared the link to the first course registration. And if you do have additional questions, please, you can email info.exl@ubc.ca and we'll get back to you on that. So thank you again, everyone, and have a great rest of the afternoon.
Thank you. Bye.